There's growing concern over the rise in coronavirus cases in India. The number of infections has more than doubled in the past week to nearly 2,000. And with testing rates still low across the country of 1 billion people, there are fears the actual numbers are much higher. So most of the new infections are connected to a Muslim congregation in Delhi. The gathering took place at the Jabli Jamaat headquarters in a densely populated slum, and so far 7,600 people linked to the cluster have been identified and quarantined. But the government is still trying to trace another 9,000 people who were involved. Now, India is just 9 days into a 3-week lockdown that many say has taken an unfair toll on poorer workers. Ishan Garg joins us live from New Delhi right now. Ishan, so the case numbers appear to be rapidly rising. Are officials bracing for a further spike?
Officials are trying to do what they consider is going to be very important few days for India. We have seen growth of one cluster here in New Delhi, which has made this place the hotspot of coronavirus infection. But at the same time, in the past 24 hours, we've also seen 2 cases in Mumbai, in Dharavi, one of the biggest slums in Asia, where one person has died who had contracted COVID-19, and another person has tested positive just today. Now, this is an area where thousands of people, if not millions, live in very, very close quarters. So there's also a possibility of an infection at that particular place. There are various estimates by experts suggesting that in the next 3 to 4 weeks, the total number of infections could go up to anywhere between 10,000 to 300,000. The Indian authorities are trying their level best to maintain social distancing, and this is where the lockdown in India really comes into place. On top of that, the Indian government is also organizing for a number of isolation wards and is trying to ramp up the testing. As you pointed out earlier, the testing numbers in India are still very, very low. And because of that, now the private players are also coming in so that the testing numbers, at least for people who can afford these tests, can go into private centers and get tested.
Ishan, India is now in week 2 of the lockdown. Have the initial teething issues been worked out?
It's a really yes and no answer. So if you consider the middle class and the upper classes who are quarantined very safely, rather, in their houses, apartments, there are really no teething issues for those people. But for the lower income groups, the answer, unfortunately, is no. There are still people who are stranded on the highways. There are people stranded on bus stops and train stops, unable to get home. We have seen this in the northern part of the country, in New Delhi, where there was a massive migrant crisis on the borders just last week. And we've also seen very similar scenes in southern part of the country as well. The authorities in these states are urging workers and migrant laborers to stay within the states, but the problem is they want to get home because they really have no funds left to support themselves. And from the state authorities, the provisions for them, food-wise and shelter-wise, are also very poor. So we are going to see some work from the Indian authorities in the next few days, hopefully, to try and solve this problem, particularly for the lower income groups.
Thanks very much for that update. Ishan Garg speaking to us from New Delhi.